Hi guys, how are you doing? It's Elaine, Bintz, holistic health coach and personal trainer, and we're on day 10 of our 30-day health challenge in the year 2022. So I hope everybody gets this week started off to a great start, and I hope your year is going well so far. So today's topic is anemia. So there's different types of anemia. I'm just going to give the general information. I'm wrapping up the blood chemistry section of this 30-day challenge, in case you were wondering. And I will be moving into more of the nutritional components after this, like talking about macros and carbs and things like that. So one of the things you're going to want to look at, if you have a complete blood count or CBC test results of yours, I'll go ahead and show you mine as an example to talk a little bit more about anemia and how you might know if maybe you are at risk for developing anemia. So I'm going to go ahead and use my CBC, and then we're looking at here red blood cells, hemoglobin, and hematocrit. So when you look at the actual numbers, there's usually a standard range or a norm range or a normal range or a healthy range. That's what that means. But what is anemia first off? If you haven't heard of it before, it's when your body, your bone marrow is not producing enough healthy red blood cells. What are red blood cells? So this is a little bit different than yesterday's topic. Yesterday we discussed hemoglobin A1C, which is like glucose and hemoglobin bound together, whereas this one is the hemoglobin, which is a part of the red blood cell. For whatever reason, your body is not producing enough red blood cells, enough healthy red blood cells. So ironically enough, we used to have boxer dogs, and one of our boxers had one of the very severe types of anemia, and her bone marrow stopped producing red blood cells, and this is actually what caused us to lose her. But you definitely need to make new red blood cells all the time. So the lifespan of a red blood cell is about 3 to 4 months. So if you do have diagnosed diabetes, or if you have been diagnosed with prediabetes, your A1C number is going to change about quarterly. So if you are managing a health condition like diabetes, then probably your healthcare provider is going to want you to go get your labs run, get your blood work done about every 3 to 4 months, if not more frequently, in order to manage the disease. So anemia, how do you know if you may be anemic? So first off, why am I talking about this? So I'm a holistic health coach. I also am a prenatal personal trainer and health coach. So I work with women throughout the process of getting pregnant, during pregnancy, postpartum. I would say a very large percentage of my clients have been postpartum for many years. And the blood values, they change a lot during pregnancy. So I personally had anemia both prior to pregnancy, and then I also had iron deficient anemia during my pregnancy. So I was able to take a medication in order to treat this, and then get rid of the anemia. But what are some of the symptoms? If you are not familiar with this disease, with anemia, it is things like fatigue, shortness of breath, and I know this is COVID, everyone has, COVID as the primary consideration in mind, but some of the respiratory distress you may feel is your body not getting enough oxygen to the cells. So some of the causes, you can talk with your healthcare provider to find out if you are diagnosed with anemia, and the treatment plan, the medications, whatever you're doing to try to eradicate or get rid of the anemia is not working. I'm not a physician. You can talk to your doctor about that. But as a health coach, we can look at your diet and see if you have foods, like if you have been diagnosed with iron deficiency anemia, we can look at your diet and see, are you getting enough iron in your diet, things like that. So this disorder, it'll lead to less oxygen being delivered to the cells, and you need oxygen for everything, not just exercise, but just everyday living. You need to make sure that if you have any one of these symptoms and you haven't had your labs run in about a year, I highly suggest you get a CBC, a complete blood count test, just to see. And again, if you do have any questions, you can reach out to me. My name is Elaine Bintz, certified health coach, personal trainer. I hope nobody gets anemia, and I hope you have a great week, and I'll see you tomorrow. Have a great day. Bye.